Hello and welcome to the Low Carb Conversations podcast. I am your host, Holly Jean. I'm joined today with my co-host, Leah. Hi, Leah.
Hi, Holly. Hi, everyone.
And our guest today is Dr. Philip Ovadia of Ovadia Heart Health. And he is a heart surgeon just coming out of surgery. He is dedicated to educating people about metabolic health and ultimately how to stay off his operating table. So welcome to the show, Dr. Ovadia.
Oh, thank you. It's great to be here with you, Holly and Leah.
It's so nice to have you on. I am very curious about your story because this isn't normally the path of a heart surgeon. And so I want to hear all about how you got into nutrition. I understand you used to be morbidly obese. So why don't you tell us about your health journey and what led you to be so passionate about educating people on nutrition and on heart health?
Yeah, sure thing. Ultimately, my personal and professional life sort of, came together to lead me to the point I am today. On the personal side of things, I was obese my entire life, from childhood. And that was despite the fact that I grew up in a household that largely followed the recommendations around how to be healthy. We ate, very much in line with the U.S. dietary guidelines and the food pyramid. I have an older brother who is a type 1 diabetic, so we didn't have sugar in the house, and we, drank skim milk while we were eating our Wheaties and Cheerios for breakfast, and we used margarine instead of butter, and all of the other recommendations that are commonly given. I was also very active as a child, so I moved more as they always recommend. And despite that, I was obese and became progressively more obese. And then, going through college and medical school and the difficult training to become a heart surgeon, my health only worsened. And many times along the way, I tried to lose weight. I would have some short-term successes, when I counted my calories and was very strict about what I ate. But ultimately, I would gain back the weight and more, which is a story that I think probably many in your audience can relate to. And about 6 years ago, I sort of came to a reckoning because I realized that I was going to end up on my own operating table. I was morbidly obese at that point. I was pre-diabetic. And, I just knew that all of the advice that I had learned during school and all the advice that I was giving my patients, it wasn't working for me and it wasn't working for them. And thankfully, I started to come across some alternative ideas around health and, the reasons why we get obese. I was fortunate to hear Gary Taubes deliver a lecture at a medical meeting. He had just written The Case Against Sugar, and prior to that had written, Good Calories, Bad Calories, and Why We Get Fat. And that was really the first time that I heard the concepts that the types of food that we eat are more important than the amount of food that we eat. And I read all his books, and I started eliminating sugar and going on a low carbohydrate diet, ultimately, getting to keto. And now for the past, 3 years, I've been largely carnivore. And I was able to lose over 100 pounds. I've been able to maintain that weight loss. I've been able to optimize my metabolic health and reverse my type 2 my pre-diabetes. And I have come to realize along the way that the disease that I was fighting against every day, heart disease, that I was fighting on behalf of my patients against, I came to realize the real root cause of heart disease, the importance of metabolic health. And I also came to realize that most cases of heart disease are preventable. And it starts with the foods that we eat. And that has now led me to a point that while I continue to do heart surgery and help people that need that service, I would much rather educate people on how not to need heart surgery and how to stay off my operating table.
And you wrote a book on this exact topic called How to Stay Off My Operating Table, right? So do you get to talk to patients before they are at your operating table, or is the book your way of reaching out to those people? Because it's pretty separated, right? Like the cardiologist and the surgeon roles, correct?
Yeah, so I actually have sort of a dual professional life at this point. I do the heart surgery, and for the most part, I don't get to meet those patients until they need the heart surgery. Kind of imminently. But I also have a telemedicine practice now that I work with people to try and prevent them from needing heart surgery and to optimize their metabolic health before they get to that point of needing heart surgery. So it's an interesting kind of perspective I get on the whole continuum of healthcare. I see patients, I am in the hospital, operating on patients and seeing that aspect of healthcare. And then I also have what's sort of a, progressive model of healthcare. I want to think the future of healthcare, where I am doing online, consultations with patients and helping them to, improve their health and prevent these health problems before they develop.
Yeah, well, it's definitely eye-catching to like run across you on like social media and be like, wait, this guy does what? He's eating what? So you talk about how you've always been overweight and your parents are overweight and your brother with diabetes. At one point, you yourself just kind of believed that you were genetically destined to always be overweight. And I know you're not alone in this belief or this line of thinking, because it is what we're taught. And you mentioned like that's what you're taught in school. So how is this thinking flawed? Like where did we go wrong?
Yeah, I think the perspective that from our genetic is deeply flawed. I think that really genetics play a small part in overall health. And yes, there are some specific genetic conditions that occur, certainly, but for most people, most of their problems are not genetic. We as the healthcare system tend to blame genetics when we can't figure out how to fix the problem. And unfortunately, that applies to a lot of the problems we face these days. I think the reason that certain things appear genetic, like heart disease, like obesity, and it seems to run in families, so we think it's genetic, is because it turns out that families, besides passing their genes down, they pass their habits down. So children eat the same as their parents do, have the same, kind of lifestyle, environment. And since food is such a powerful, predictor of our health, since the types of food we eat has such a large influence over our health, that makes it appear that genetics are at play. But the reality is it's just because everyone in the family is eating the same foods that they develop the same health problems.
Yeah, that's such a good point. And it's so overlooked. I think it's like, yeah, it's not necessarily genetics, but it is that those mirroring habits that we pick up throughout life and our environments around us. So that's a good point. You talk a lot about the calories in and calories out diet mindset, and you've done all the things, the Weight Watchers, the Nutrisystem, and like a lot of people, you lose the weight and gain it back. I think I know I can relate to that. I know Leah can relate to that. And I know a lot of our audience can. If you can go back and like put yourself back in that psychological state you were of in being stuck in that yo-yo pattern or that habit, like what would be your advice to someone to help them get out of that mindset and try something different?
Yeah, my advice is simply that the key to losing weight sustainably is to find a way to not be hungry all the time. And that's really, the central problem with all of these types of restriction diets is that they keep you hungry all the time. And so no one ultimately has the willpower to be able to do that over a long period of time. We can do it over a short period of time, but we can't do it long term. So instead, when you eat the foods that are going to make you hungry less often, and that is basically the whole real foods, the non-processed foods, that is going to allow your body to kind of, be able to lose weight without that constant struggle. And, when I look back upon, my entire life and my, all of my sort of thoughts around food and my efforts around losing weight, and now I see where I am today, at a point that I truly am able to eat when I'm hungry, eat until I'm full, and yet, be in optimal health and, be at the lowest weight, of my adult life, without the struggle. That is the powerful message that I try and get through to people. But it's hard to get people to realize that, because most people have struggled like I did for so long, and they truly don't believe that you can lose weight without, struggling, without being hungry all the time. But once you show them, once you educate them, and once they try it for themselves, it usually, catches on pretty quickly, because it is such a powerful tool to use.
It's really interesting because I had that exact kind of question to ask you, and I might just jump in now about some of that. So I wanted to, we've got an article, which I'll go back over in a minute, which is about a family in Malaysia that has changed their dietary lifestyles. But as I was reading through it, I was thinking compliance is definitely one of the hardest issues that people face. And like you just said, hunger is the biggest kind of issue inside of that. I was just wondering, what other kind of non-compliant type issues that you see with your patients that you've been working with that they struggle with in today's world?
Yeah, so I think, the mindset is, a very key issue that I reinforce with patients. And, in my book, I go through 7 principles of metabolic health. And the first principle is about the mindset. And specifically, what I, educate people to do is that you need to think of your health as a system, not as a goal. And, what that means is that you can't be focused on the short-term goals of losing weight, let's say. When you say to yourself that you want to lose 20 pounds, one of two things is going to happen. For most people, what happens is you struggle and you're not able to lose the weight, and you kind of get down on yourself and you get, depressed, and you just give up.
Beat yourself up.
What does it matter? I can't lose the weight. And you go back to your old habits. Even those people that are able to lose the 20 pounds, what they tend to do is say, great, I did what I needed to do. And then they kind of drift back to their old habits. And, soon enough, the 20 pounds and more has come back on. So instead, what I try and get people to do is think about, the overall system of their health. Say to themselves, I want to be healthy. I want to be metabolically healthy. And I am going to find the habits that support that. And I think that's a more positive, way to think. And it's a more sustainable way to think.
Yeah, that's so true. It's it's almost like you're not flipping a switch, but it's just something happens over time. And people are always trying to seek the answer to what that is. But what you're saying is these habits that you change daily, regularly, the smaller kind of habits that you're always making, eventually you're living in that moment rather than just thinking all the time, I've just got to lose 20 pounds. That's not the way to approach it with that type of mindset. Is that kind of along the lines you're saying?
Yeah, exactly. And I tell people, I educate people to focus on their metabolic health. And the weight loss is going to be a side effect of that.
Mm-hmm.
If you need to lose weight, when you get metabolically healthy, you will lose weight. Your body finds, the weight it should be at. That's sort of the power of focusing on metabolic health first. And then, all the other stuff tends to kind of follow along.
Yeah, I love this. It's so refreshing listening to someone in your profession speaking this way. And I know there's more and more people coming out. I saw that you've been featured in Diet Doctor. And have you been doing, I know there hasn't been a lot of big events on because of the pandemic, but have you gotten on the speaking circuit yet, reaching out to more people?
Yeah, so I was fortunate to be able to speak at Low Carb USA, which was actually an in-person meeting a few weeks ago. And as you said, there are more and more physicians that are, tuning into this. There were probably 40 or 50 physicians at that meeting from all different specialties, along with, a couple of hundred non-physicians. And so, that's one of the things that is really enjoyable, I would say, about the whole low carb movement, is how it's bringing together physicians and, physicians, other healthcare practitioners like nutritionists and dietitians, and then, the non-healthcare, people, the patients, the people who are benefiting from this, the engineers and the computer scientists that are working out, a lot of these things that, quite frankly, the medical system is not good at looking at, because there are just so many biases that are cooked into the medical system. There's so much history of how we always have managed these things that sometimes it becomes difficult to see a different way when you're, kind of entrenched in the healthcare system.
Yeah, that's so true. And yeah, it seems like we're moving into some really good times where we're looking at health more as a holistic picture rather than just so systematic as we've always kind of looked at it. Yes.
Yeah, sorry, I was just going to say, I hope that is the case moving forward. Unfortunately, what I see, again, when I'm in the hospitals, when I'm, in the, kind of traditional healthcare system, unfortunately, that doesn't get recognized very much. It's only when I kind of step outside the system and into these other circles that I see so many people talking about, holistic health and preventative health. But I hope ultimately that the mainstream healthcare system is able to start to change towards that, because the reality is that the healthcare system in the United States and worldwide is broken. It's literally collapsing under its own weight. There are so many sick people to take care of, even before, we get some, viral pandemic that stacks on top of that. Just with the obesity and the diabetes rates as they are, there are so many sick people to take care of that the healthcare system is getting overwhelmed. And I think the way out of that is to get less people to be sick. And I think focusing on metabolic health, focusing on the foods that we eat is the way to do that.
So true.
And maybe if we just started by putting better food in the hospitals and getting rid of the vending machines. And so when people are in the hospital setting, they're not looking around and seeing all the junk food and thinking, oh, okay, well, this is at the hospital, it must be normal. Let's start putting in some good food and better choices.
Yeah, it's a huge problem. I again, in my heart surgeon role, it's increasingly distressful making rounds every morning and seeing the food that the patients are served, going to the hospital cafeteria and you see that it's just the processed food, the carbohydrate dependent, low fat diet, US dietary guidelines. And it's just so obvious that is not working. And yet, we can't move forward. The hospitals are literally, beholden to the US dietary guidelines. They really have no choice but to serve food that is along the lines of the US dietary guidelines. And the US dietary guidelines have become progressively, pushed our food system towards a heavily processed system. and it's clearly not benefiting our health. And again, this isn't only a US problem now, this is a worldwide problem.
Yeah, and definitely is, like, circling back around to the article. I saw this article coming around in all the kind of, low carb keto Facebook groups. People were reposting it, and it's talking about a family in Malaysia who pretty much switched the foods they were eating into a more ketogenic style diet and cleared up a lot of their health issues that they had, causes that were caused from inflammation. So I think a few of them had diabetes, high blood pressure, anxiety, Alzheimer's, all those kind of things. And they tried to follow what the doctor was recommending for them, which was whole grain fruit and vegetables. But the lady in the article says whenever she ate the foods, especially the carbs, her blood sugar would get really high, and then she would get the shakes. And then her doctor told her that she was expecting too much from what she was doing, which is just sounds ridiculous, and prescribed more medicine for her. So I think, lucky for her, she was tenacious in finding a way and came across keto and then put the whole family on it. And I would say that this family is probably a good example of people staying off your operating table who were headed to the operating table. And I just wanted to talk a little bit about, there's a few things in this story, but like typically, are you seeing clients coming or patients coming through that are making these changes and having great success? I'd love to hear about some of your success stories. And also, do you think that, like moving away from their traditional rice foods and switching out for cauliflower and rice and things like that, are you seeing more of this happening, or is there still a lot to go through to make these changes?
Yeah. So, again, I get a somewhat skewed view of things in my telemedicine practice, because these are people who have seeked me out. So they have already, made the decision somewhat that they needed to do something different for their health. But I certainly have seen, amazing results. Type 2 diabetes reversed, frequently get off, people are getting off medications for high blood pressure. I see many of the autoimmune and inflammatory conditions like ulcerative colitis was mentioned in this article. And, again, something I've seen in my patients, that those conditions improve dramatically. If not, kind of go into remission or reverse completely. And so, I almost have to temper myself sometimes, because, I start to question myself when almost every condition that people come to me with, and they say, can this be helped with, a low carb, metabolically healthy diet? And the answer invariably is yes. And I can, if it's not something I've dealt with personally, I can get out there in the community and find people who are reporting that they have improved, this condition with a focus on, eating whole real food and low carbohydrate, lifestyles. So it never ceases to amaze me, quite frankly. And I think it is disappointing that the healthcare system as a whole doesn't recognize this. And it is so common that people will come to me and they will say, my doctor said that I can't reverse my diabetes, or I can't get off my blood pressure medication. And it's just the fact that most physicians truly don't realize that this is possible. They have never heard it, because this isn't taught in schools. This isn't talked about at medical meetings for the most part. And so, and they've never seen it themselves. They've never seen a patient come off insulin, so they don't believe it's possible.
Yeah, it's so true, isn't it? And did you do any further study, or did you just use yourself as the example to change over to the diet, saw that it was working for you, and then went, this makes sense? Or have you done any further training through anywhere?
Yeah, so, I haven't gone through any additional formalized training, but I have spent, so many hours at this point, researching these topics and reading the articles and talking with the other, thought leaders and scientists and physicians involved in this. So while I haven't gotten, any official certifications to add, I have plenty of those, and I have all the letters after my name.
Yeah.
It really is an ongoing education. It's a nonstop education. And again, that I think is something that most physicians need to, kind of recognize, that we can never stop educating ourselves as doctors. If you finish medical school and think that, all you need to know, that is a very poor way to approach, being a physician.
I love that. I love how, just continue to learn, and then you're able to change your view on certain things that you thought were the right, or that was the right way at that time, but further evidence has come out about it and you've become really researched about it. And I think that's, so inspirational for other practitioners to learn as well.
I think it's the same for any profession. You don't get out of school and start your job as a teacher or a lawyer and then just stop learning. Like, you always have to be continually educating yourself and changing as data and science changes as well.
Well, and again, you would hope that would be the case, but unfortunately I see it, way too often that it isn't. It's kind of ironic. One of the things that, we hear over and over in medical school, I think, the vast majority of physicians will tell you they heard during medical school, the kind of saying that half of what you learn in medical school is going to be proven to be wrong by the time you retire. We just don't know which half. And as many times as I heard that, during medical school, we are now in an environment where it's almost impossible to question, things that are thought to be the truth in medicine, for instance. And, when you say, well, maybe this isn't quite, right, you really, you get a lot of pushback, and, you start to be viewed as a troublemaker, or, you're not following the guidelines you're told, and, you kind of get, beat down a little bit. But, the reality is that it's incumbent on physicians to remain curious, to constantly be educating themselves. And that doesn't just mean learning new things. It really needs to include reevaluating the things that you have always thought to be true.
Yeah. I don't want to get political or anything, but do you think there's the reason for getting pushback for questioning things has something to do with the fact that pharmaceutical companies provide so much money for the industry, and lobbyists for food and ag and sugar, like they have their influence over what is taught and what is learned? So do you think that's where a lot of this pushback comes from? It's like, hey, don't rock the boat, because that's where our funding comes from.
Yeah, I think ultimately, one of the other things that troubles me so much is that, the two most important participants in people's health, the patients and the physicians, have the least power in healthcare these days. Really, the physicians have largely been sidelined in the, kind of big decisions about what directions the healthcare system moves in. And the patients have been marginalized as well. And I think that is really the central problem that we are, need to fight back against. And one of the other messages that's in my book is that, everyone needs to take back control of their health. You can't rely on other people to make you healthy, other people to keep you healthy. The government isn't going to do it. The healthcare system isn't going to do it. And it's up to us as individuals to demand the control of our health back.
I love that. I'm going to take that whole quote and just put it on the the episode cover for this. All right, well, let's poke the bear a little bit, because I have an article here that says the American Heart Association has a statement that finds few with diabetes reduce heart disease risk. So it's saying, it's a scientific statement issued by the American Heart Association. It's saying that fewer than 1 in 5 adults with type 2 diabetes in the US are meeting targets to reduce heart disease risk. I guess my big question here, we can talk about this statement, but first I want to talk about the connection between type 2 diabetes and cardiovascular risk, or diabetes in general, or metabolic health in general, and cardiovascular risk. Because I think a lot of our stuff in the medical world is so compartmentalized. We look at it as completely different things, and people don't really see that those are very much connected. So can you just touch a little bit about why those two things go hand in hand?
Yeah. So, heart disease, has been the number one killer in the United States, and worldwide now for, 30 years, uncontested. It's not even close. And despite the, ongoing efforts to, improve that, we really, are not making a whole lot of ground in that battle against heart disease. It is clear, that type 2 diabetes, poor metabolic health are the biggest risk factors for the development of heart disease. And yet, if you ask most people, what causes heart disease, what's the biggest risk factor for heart disease, they're going to tell you cholesterol. And that is most people and most physicians. So I think it's very unfortunate that, we have become so focused on cholesterol, and that is to the exclusion of everything else. So when you talk about, metabolic health being the primary cause of heart disease, when I put those statements out, on social media, I end up getting a lot of pushback, and they say, no, it's cholesterol. And, what I answer back is that cholesterol is part of the process, but it's not the root cause. And that's clear from so many, sources of data. But, the American Heart Association and other organizations like it have become so focused on cholesterol and cholesterol only as the cause of heart disease that they are unable to see, all of these other obvious factors, and they are unable to focus on how to improve those factors.
Okay, so tell us about your book. Do you go over all that stuff on how to improve those factors in your book? Oh, it kind of froze.
So, so in the book, I first talk about how best to assess your metabolic health. And I think that's the important first step, because I think a lot of times, physicians and people, just make assumptions about their metabolic health. And the reality is that you need to look at specific measurements to determine if you are metabolically healthy or not. The 5 basic measurements that I advise people look at is their waist circumference, their blood pressure, their fasting blood glucose level, their HDL cholesterol, which is your good cholesterol level, so-called, and your triglyceride levels. And, if you go to the book, or I have a website, ifixhearts.co, and that will actually take you through those measures and, show you whether or not you're in the healthy range. So the first step is assessing your metabolic health. And importantly, you can't assume that just because you're not obese, it means that you're metabolically healthy. What we see from the data is that even people who are normal weight or underweight, they have more than a 50% chance of not being metabolically healthy, up to 70% in some studies. So that's the first step. And then, if you're not in optimal metabolic health, you need to make changes, and those changes start with the foods that we eat. And as I've mentioned before, my underlying principle is to eat whole, real food. Along with that, I lay out other principles of metabolic health in the book. I have 7 principles in total, but a couple of the others are to make sure that you're managing your stress, make sure that you're getting adequate sleep. And one of the other important principles is finding a physician or a practitioner that understands this and will help guide you through it as well.
That's key. You have to have a supportive medical support. Wonderful. And I also like that in the book for our listeners, because we really like debunking things. You go over 12 myths that they want us to believe. So it really looks like a wonderful book that is called Stay Off My Operating Table, a heart surgeon's metabolic health guide to lose weight, prevent disease, and feel, what's it say, younger?
Feel your best
off.
Every day.
Feel your best.
Yeah.
Thank you. I just see the like it cut off on my screen there. Sorry about that. Okay. And you dropped your website there, the ifixhearts.co. That's where people can go and do their own assessment. Is Instagram also the best place to find and interact with you?
Yeah, at Instagram, I'm at Ovadia Heart Health, and then on Twitter, I'm at ifixhearts, and try to stay active on both places.
Okay. Wonderful. Leah, do you have anything to add?
No, I just think it's so refreshing to meet someone like you when we're, so many people out there that still have the blinkers on. And so thank you for the work that you're doing. And I look forward to hearing more from you. Yeah.
And I'm looking forward to you getting some more haters. So that's how we know you're getting the message out.
Sounds good. Maybe you can have me back on a second time and we can get into some of the real controversial
That's right.
stuff.
Yeah, that's when I'll be like, oh, we have the most controversial surgeon in the US on this week. All right. Thank you so much. That is the end of today's episode. Our theme music is created by Andrew Bowden, and production services are by Kevin Kennedy Spain of Discolite Media. Have a great week, everyone.
Have a great week.